David Eby is with us. Good morning to you.
Good morning, Stephen.
Thank you so much for being here.
Thanks for having me.
Is it your pitch to be the premier that you want people to vote? A vote for the NDP is a vote against John Rustad. Is that the basis of your campaign so far?
No, not at all. The pitch that I'm making is that whether it's affordability related to housing or just cost of daily life, whether it's our healthcare system, or whether it's building a strong and clean economy and strong and safe communities, that the NDP has the best plan, that we're actually turning the corner on some of these major issues. More people with family doctors, rents are finally starting to come down. And now's not the time to go to the cuts, division, conspiracy theories, and hate, frankly, of a number of the Conservative candidates.
Your campaign has been so focused on John Rustad and on that division and on those conspiracy theories and pointing out what candidates have done and said in the past and bringing that up. I mean, rather than telling people what you are going to do for them.
Yeah, I think it's a ballot question. I think it's important for people to know because you don't know all of the things that are going to happen over the 4-year course of a mandate. We didn't know that we were going into a huge global pandemic, and then we didn't know that interest rates were going to go through the roof and that we were going to face global inflation, all these things, climate emergencies, floods, forest fires. So people need to know what the values are of the people they're electing. And so if you're putting forward a candidate that thinks that vaccines cause AIDS or that calls people who are gay groomers or slurs the Muslim community and says they don't have a place at the table, how does that inform how your cabinet will make decisions when you're in government?
Again, but what you've just said has become boilerplate for you through this entire campaign. Instead of, again, you throw in these criticisms of your opponent rather than telling us what you're going to do.
Well, Stephen, I think it's important for people to know who's running. In my own constituency, a guy named Paul Ratchford, on Orange Shirt Day last year, this is the day when we recognized what happened to Indigenous kids at residential schools, posted a tweet that said he wouldn't wear an orange shirt because he wouldn't stand for the misrepresentation of Canada's history. And he went on from there. And so it is important for people in my community when they're marking a ballot to know if they're interested in reconciliation, if they believe climate change is real and an urgent issue, if they care about the diversity of this province and it being a safe place and welcoming for everyone, then the NDP is the place to mark the ballot. This is a serious election around those values questions.
And what about the people who are looking for a job that pays a decent wage, that need to make a living because they have to go rent an apartment that's costing them $2,500 for a one-bedroom apartment? I mean, there are day-to-day, just cost of living issues that are inescapable and that people are looking to government to help with.
Absolutely right. And so our concrete proposals on that are immediate support with the cost of living, with a tax cut for middle-income households, strong action on housing.
This is the $1,000 a year.
The average is $1,000 for the average household, and you don't have to own a penthouse in downtown Vancouver to benefit fully from it, like John Rustad's long wait program that kicks in 2029. It's immediate. It's for all taxpayers in the province. The first year is actually for people on disability as well.
When rent for a one-bedroom apartment is $2,500, how far does $1,000 go in a year?
Yeah, well, it makes a difference for a lot of families. And also, we need to work on affordable housing. And this is another critical issue. John Rustad's housing plan doesn't add a single new unit of affordable housing, not one. And for people who are interested in driving down the cost of housing, you have to build more rental housing. You have to control the excesses of Airbnb, people buying up whole homes and condos to turn into hotel rooms. You have to address people buying up homes and leaving them vacant through the speculation of vacancy tax. John wants to get rid of all of those things. And I know it is brutal out there for housing right now. It would be so much worse. And our proposal to build 300,000 middle-income homes across the province, that's what experts say our plan, just getting rid of the red tape around building townhomes would do. John wants to get rid of that too.
But all of that costs money, and you took what was a surplus budget under John Horgan and turned it into we're in a situation now where you're facing an accumulated deficit of nearly $9 billion. I mean, the highest ever in the history of this province. That's on you heading into this election.
Yeah, we're facing in the provincial budget the same pressures that people are facing in their household budgets. We're at the bottom of the economic cycle. Resource prices internationally are at some of their lowest points. Slowing global economy, global inflation, all of these are having an impact. So there is a choice even. And that's whether we support people right now when they need that support or whether we don't. And we think we should be building our healthcare system and school and education system and roads and transit because we added 300,000 people to our province in the last 2 years.
Why
so if you cut now, the devastation will be significant at the bottom of the economic cycle when people are really struggling.
Why are chambers of commerce and business organizations telling us to vote conservative? Why are you not having the support of the people who are bringing business into this province and creating jobs in this province?
Yeah,
in the private sector.
I don't think that's correct. There are a lot of businesses that are supporting us. We supported business through COVID, and we're going to continue to support business. We have one of the lowest small business tax rates in Canada. We've got, on the resource side, there's 17 mine proposals across the province. We are the fastest growing GDP of any of the large provinces. Doesn't matter if you look at last year, since the pandemic, or since we formed government. We've got one of the lowest unemployment rates. We've got the fastest growing wages. And we got to keep going,
But the BC Chamber of Commerce says that it is imperative that the government bring down the cost of doing business, that it needs to become more affordable to do business in this province. And so where does this idea come from that, the NDP is and business are somehow incompatible?
My commitment to the business community, and I've heard their concerns about that, and we need to make sure that we're working with them to make it as easy as possible to do business in the province. We've committed to do a review with the business community with agreed metrics that we're going to look at, including cost of doing business, to ensure that they have the confidence needed. But we're also posting some pretty good numbers. We have 70% more investment in the province in the last 2 years than the last 2 years of John Rustad's administration. And we've got to continue that growth. And we're also doing the clean economy, more than $1 billion in investment in green hydrogen in the province as we grow that industry. That's private sector investment. So we can do these things. We can grow the economy and protect the planet, and we're going to do it.
I want to talk again about the way you have been trying to woo voters, both you and John Rustad, in fact. I mean, it's the old bribe voters with their own money thing. I just want you to hear what a couple of people or what people had to say on the street about this.
No, I just don't think either one of them is going to do anything, really. Like our monthly expenses are conservatively around $8,000 a month. I don't know how $50 is it's not gonna change anything. Not even one night out for the three of us. It's just insignificant, honestly. It just won't change anything.
And so, as I put it to you earlier, I mean, is what you're offering really something that is going to make a significant difference in people's lives?
Well, if it were just the tax cut, I think that's one thing. But it's the tax cut. It's affordable childcare, families saving $900 per child. It's car insurance. Rates are down $500 in 2 years of stable rates, frozen rates going forward. Hydro rates flat. They went up 80% under John Rustad. And we've got to do more. You can hear it in that guy's voice. People are feeling a huge amount of strain. And we're going to continue to support people to make sure that they're able to cover those costs of daily life. I think people know that government can't solve all these problems, but wherever government touches your life, whoever is leading the province should be focused on reducing costs for people.
The most dire public health emergency that we've seen in BC is the opioid crisis, the poison drug crisis, to be specific. Can you understand why some people might look at the situation in BC today on the streets of our cities and towns, why they look at that situation today and think that the NDP has run out of ideas, that the NDP has failed them?
Well, this is one of the hardest issues that we face. The drugs that are on the street are the most addictive that have ever been available to humans. And there's a growing cohort of people that have survived multiple overdoses with serious brain injuries. It's affecting their behavior and communities. And in attacking this problem, we have to try different things. And, it's so extreme that, yes, all the parties, along with the chiefs of police, said, why don't we try decriminalization and see whether if we remove that stigma of the criminal justice system, and I've seen how the criminal justice system fails people who are struggling with addiction, then maybe they'll come forward and ask for treatment, ask for support. Well, our hopes were not met by the realities of that, and we had to change course.
But you didn't give it enough time, is what critics will say.
Yeah.
I mean, you stood there at the debate and said, the decriminalization pilot, it was a bold idea. It was something new that needed to be tried, that things were broken. And then as soon as the political tides turned and people started talking about how it was destructive to their communities, whether or not they had evidence to support that, you backed off.
Well, I think it's critical to listen to people. And, when you're talking about what I saw and what many people saw in their communities, we didn't see people feel comfortable coming forward to ask for support on treatment, what we saw people feeling comfortable doing is, especially people really struggling in the depths of their addiction, is basically using drugs anywhere, and police struggling to know how to respond to that. And the result being communities feeling increasingly unsafe for so many people.
Was it really that different from what we had seen in previously?
Yeah, people using drugs in coffee shops, on buses, in
nothing new
hospital
about
rooms.
that.
Yeah,
People have put special lights in bathrooms so people can't use drugs. That's been going on for years.
Yeah, I mean, I can't have a debate with you, Stephen, about the depth of the
No,
unhappiness
I understand.
that.
What I'm saying is, Lisa Lapointe, the former chief coroner, and your own provincial health officer, Dr. Bonnie Henry, both disagree with you. They both want to see the Safe Supply program expanded. You need to put clean drugs in the hands of drug users. Otherwise, people will continue to die.
Yeah. I just disagree with them on that. I mean,
distributing. That's not.
I don't think that government distributing crystal meth, crack cocaine, and fentanyl through co-op is going to solve this crisis.
Not through a co-op. What about upscaling some of the programs that are already running? Crosstown Clinic, for instance.
Well, I think that there's a lot of work that we can do to improve services in clinics, but I don't think government-distributed hard drugs are going to solve the problem. I think providing people access to treatment that's seamless, like our initiative, the Road to Recovery at St. Paul's, where you show up at the emergency room with an overdose, you can go right into detox, right into treatment, be paired up with that kind of support is absolutely critical, as well as the prevention work. And we're starting in schools and supporting kids who are vulnerable with breakfast programs and different extracurricular activities. Our proposal in the budget around recreational activities for kids is actually directly related to this crisis as well.
If somebody wakes up one morning and says, that's it, I've had it with this drug thing, I'm got to get myself into treatment, how long do they wait before they find a place in treatment, a bed in residential treatment?
We've opened hundreds of new beds, and one of the problems we saw was that.
Wait?
Well, just let me finish. So one of the problems we faced is people had to call multiple different places to try to find a bed. So what we did was we established one phone number for all of the treatment programs in the province, and through that phone number also access to physicians and nurses that are experts in addiction, so that they call that number and they get access as quickly as possible, ideally right away. One of the barriers is detox. We need to open more detox beds in the province because many treatment programs require you to have gone through that first. But we're in a significantly better place than we were, and we've got to open more beds, and we will.
But if people detox, is there room for them to get residential treatment?
Yes.
And is
the
government ready to pay for the second, third, and fourth relapse of that person? Because we all know how long it takes for somebody to actually clean themselves up out of drugs, or to have the help to clean themselves up out of drugs.
Yes, there are beds, and there's opportunities for people who are relapsed to go back. And anyone who needs assistance should call in and ask, and we can get them connected to that treatment.
You mentioned healthcare in that you say people are getting more family doctors or more access to family doctors than they have had. I still know everybody I know is still struggling to find a family doctor, especially people whose doctors are retiring right now.
Yeah.
My 3 children included.
Yeah, the family doctor, nurse practitioner is the gateway to the medical system. Every minute without a family doctor is hugely stressful. We still have hundreds of thousands of people on our Health Connect registry waiting for family doctors. The good news is that we've connected 250,000 people in the last year to a family doctor. We'll be connecting 160,000 in the next 6 months, so the rate of connection is increasing. And with our projected graduates and doctors who are coming online, everyone who wants a family doctor will be able to have one by the end of 2025.
And Lillooet this weekend, emergency department closure 3 nights in a row, 4 nights in a row. I think it was 3. You have this happening routinely in smaller communities. What do you do about that? I mean, that's unconscionable.
This is a really stubborn problem, and it's awful. I can't imagine what it would be like waiting for an emergency room or driving there and realizing it's closed when you're in health crisis. So it's an urgent problem. We've increased incentives for people to practice in rural areas. We're graduating more doctors and nurses, and we'll be directing the College of Physicians to provide provisional licenses to national physicians immediately and international physicians from certain jurisdictions within 6 weeks. And in addition to that piece, there's red tape between the different health authorities that stops doctors and nurses from moving around to different hospitals to provide support. We're going to get rid of that.
You come in here, as do a lot of people who represent the NDP, and tell us about, your tenure so far as premier and how things have improved. Housing is getting better. People are getting more family. You're giving us numbers, telling us that things are getting better. Everybody tells me they don't see that happening around them. Help me out with that disparity.
Yeah, I don't pretend for a second that people aren't struggling, that we don't face serious challenges in the province, that people are frustrated right now. That's real. What I can say is that for these big challenges, which are not unique to us, I mean, the price of food's a topic of discussion in the presidential debate. Across Canada, our healthcare system is feeling strain. What I can tell people is what we're doing in British Columbia, what we're implementing is the best way to address these issues, that we're actually making progress, unlike other provinces, on these issues. Family doctors, housing prices finally coming down, and we got to keep going. Cutting is not going to get us further ahead here.
David Eby, we will leave it there this morning. Thank you very much. Appreciate your time.
Thanks for having me. It's a privilege to be here, and I hope that John Rustad engages the listeners in the same way.
We hope so, too. David, thank you very much.
Thanks, Stephen.
David Eby, NDP candidate in the upcoming election, and, of course, voting day, Saturday, the 19th, this coming Saturday.